To health matters now, where stakeholders in the nation's health sector are advocating for the upscaling of vaccination against the human papilloma virus to reduce its impact across communities. They are also calling for increased awareness regarding myths surrounding the disease. This effort aims to ensure that those eligible for vaccination welcome it without fear of the unknown. Trust TV's Sumaya Abubakar has more.
The human papillomavirus, also called HPV, is a common virus spread by sexual activity. While some strains cause genital warts, others can lead to serious health problems like cervical cancer. Health experts say while the body usually fights off HPV on its own most of the time, the virus, however, lingers, potentially causing issues later in life.
We have different strains of HPV. So we have some strains which we call the low-risk strains. Those strains do not cause cancer. Those strains cause some benign lesions like warts. But we also have the high-risk strains. So for instance, you hear about things like HPV 16, HPV 18. Those are the strains that we know can cause cancers.
A whole lot of people will come in contact with the virus. However, the majority of people will deal with the virus with their own immunity. Around 90% of people will clear it. So the 10% of people who won't clear it will be due to probably poor nutrition. They probably have another disease they are dealing with which affects their immunity, like HIV. Or they are taking drugs that dampen their immunity.
The Nigeria Center for Disease Control and Prevention recommends getting the HPV vaccine for children between the age 9 and 14 years old before becoming sexually active.
The vaccines are available free as a single dose, especially in the secondary health institutions, that's general hospitals. We have about 5 or 6 within the FCT, and they are free. Now, the target is girls between the age of 9 and 14. The reason being that you want to prime their immunity before they get contact with the virus. Unfortunately,
misinformation about the HPV vaccine is widespread. The World Health Organization's Africa office estimates that about 25% of the population still has doubt. In Nigeria, health workers are battling with the unfounded rumor that the HPV vaccine will later keep young girls from giving birth.
I want to encourage parents that getting the HPV vaccine will not make children have a sexual experience earlier than they would have otherwise. HPV vaccines are not associated with infertility. We haven't seen any studies that show that.
Higher acceptance in the northern part of Nigeria, while in the southern part, specifically states like Lagos, Edo State, and a couple of states in the southeast, where we have the anti-vaxxers who came out in their numbers and made videos and circulated on social media platforms.
Stakeholders who are working on sensitizing the public on the importance of getting the HPV vaccination say it is a continuous process.
The WDCs, the religious heads, the community leaders, that is where they come in. And they have been doing a lot to be able to get the people to access these vaccines.
We're looking at a vaccine that could change the course of cancer, cervical cancer in Nigeria.
As the fight against HPV continues, experts and community leaders are calling all hands to be on deck to prevent the spread of the HPV that leads to minor and major diseases, and a call to not let myth cloud your judgment. Sumaya Abubakar, Trust TV News, Abuja.